Edutainment Studios welcomes you to Health Insurance, Knowing Your Options. This module is part 3 of a 6-part series on health insurance. Health insurance can help you stay healthy by paying for all or part of the medical care you need. However, it's easy to feel overwhelmed with today's health insurance options and requirements. There are more types of health insurances to choose from than ever before. All these choices, along with new laws created to protect you, make choosing a health insurance plan more confusing than ever. At the same time, the health insurance providers are putting more expectations on you to take greater control of your own health care. In this course, the objective is to help you explain the different ways you can obtain health insurance. There are 5 ways that health insurance can be purchased. Each avenue provides different choices between the different plans. Employers who offer insurance usually provide managed care plans. The employer themselves may pay for part of the plan's premium, but the choices will be limited to the type of insurance they want to offer. You will still have a choice of how much the premium will be and how much coverage will be afforded. Check with your human resource department and make sure you qualify. If you do, you can then ask for a listing of available plans and details on each one. The marketplace is a website where different health insurances and plans can be compared. Sometimes this is referred to as an exchange. You can answer some questions about your family's income to see if you qualify for a subsidy. A subsidy is where the government helps pay for all or part of the patient's health insurance costs. Some states have their own insurance marketplaces. If they do not, anyone can sign up for insurance on the federal government's marketplace at www.healthcare.gov. Plans on the marketplace are labeled as bronze, silver, gold, and platinum, depending on the amount of cost sharing you will be responsible for. Bronze plans generally have the lowest monthly premiums but the highest deductibles. Platinum plans generally have the highest monthly premiums and the lowest deductibles. Start shopping for health insurance and see if you qualify for a subsidy by visiting www.healthcare.gov/get-coverage. You can go on your own to a comparison website which sells different types of health insurances from different insurance providers. They will allow you to compare plans and prices and immediately sign up for the one chosen. An example of one of these sites is Plan Finder at finder.healthcare.gov. An insurance plan can be purchased directly through a specific insurance provider. This can be very convenient if you already know which doctors you want to see and which plans those doctors are in network with. To get started, call and speak with an agent, or you can visit the website of the provider you're interested in. Insurance providers will have their own websites, listing their own specific plans. Unlike insurance agents who usually work for one insurance provider, insurance brokers deal with a number of different providers. A broker can help you pick the best fit plan for you from among all the different providers. Brokers do not often charge for their services as they usually get paid by the insurance providers whose plans they sell. You can find a broker by asking friends and family to recommend one, or search online for one in your area. Reading reviews from others who have used that broker can be helpful in the selection process. Your doctor or their staff cannot tell you a specific insurance plan or carrier to use. That is illegal. The best thing they can do is advise you to contact a broker or the different carriers and have them send an agent out to help you decide. There's an open enrollment period that occurs once a year. This is generally the only time you can sign up for a managed care plan. However, there are some qualifying life events or life changes that will allow an exception to the enrollment timeframe, like getting married or having a baby. In such an event, you would have 60 days to choose a plan. Open enrollment and qualifying life events can vary between different insurance providers and between plans that are on and off the marketplace. Note the open enrollment period for the specific plan you are considering. The insurance plan chosen can affect an entire family's long-term health and finances, so it's important that you research thoroughly when picking a plan. Here are some questions you should keep in mind as you compare different plans. How much is the monthly premium? What benefits does the plan cover? Which doctors and hospitals are in network? Is a referral needed to see a specialist? Is there a copay for medications? What is the out-of-pocket maximum? Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of the 6-part series on health insurance, and come back for part 4.